Hi, my name is Jared Carter with Carter Physiotherapy. I'm here with Max Bookman of Max Training in his amazing gym. I swung by today because he took a spill on his bike and busted his shoulder and AC joint. And we're going to see how much progress we can make with getting rid of the last bits of range of motion issues and pain in just a few minutes of techniques. But first, why don't you tell them exactly what happened and kind of where you were, where you're at right now.
So, crashed on my bike. I went over the handlebars and landed on my shoulder and got a partial kind of separation
Of AC joint?
of my AC joint. And now I'm at like 90% pain-free range of motion, but this range right here, especially with pressure, hurts the AC joint, and then I feel pressure and pain kind of radiating down the collarbone. And then I get a slight pinch overhead too, but nothing terrible, but I can feel something's not right.
Where is the pinch when you go up overhead?
It feels like it's right on the AC joint. It's anterior on the top.
On the top, anterior side. Okay, slip off your shirt and let's have you sit here first. All right, and then here, I'm just gonna turn you sideways if you wanna come in a little closer. So the first thing I'm gonna do, actually, there's a few things I know that will probably make a difference, but I want to actually see if a little work on the upper trap and then the supraspinatus muscle underneath it is going to make a difference. It may or may not, but at my clinic, we really kind of go about things scientifically, and we like to do a lot of retesting after each technique, or one or two techniques at most. And even though sometimes I know if I can dive in and make a change in one area, I want to start with something I'm not sure about, just to see if it might be involved in the issue. Because once you've made a big difference, if you kind of go straight first for that thing that you know is going to make a big difference, then you might be missing another piece of the puzzle because it feels so much better immediately. So we're just going to kind of do a little bit of work on the upper trap. Let me know if any of this is too much. He's a tough guy, so I think he can take it. And then come on in a little bit closer so they can kind of see. So I'm getting pretty deep right through the upper trap, which runs all the way up into the head. And fascially, or connective tissue wise, a lot of issues go kind of less than completely resolved because you don't take these techniques, or if someone doesn't take these techniques, not just to the end of the muscle, but past that point, because the fascia does usually continue on. And I'm just kind of following what I feel happening, and he actually has some kind of lines of tension all the way up into like the temple here. And so go ahead and stand up and let's just see real quick. Again, we don't know if this is going to make a big difference, but I was curious if upper trap had anything to do. Does that pinch at the top, did that change?
That's a significant difference in that end range pinch that I had at the AC joint.
Okay, now here's good. So we know now the upper trap was involved in that flexion pinch overhead. Not sure what we're going to feel here, but just check and see if it changed anything with that as well.
You know that the AC joint does feel better there. I still feel some pressure going down the clavicle.
Okay.
But yeah, there is some improvement.
All right, so let's have you sit again. So I didn't really, I figured that the flexion was going to get better. I didn't think that we were going to also get a change in the AC joint, so that's a bonus. So now I'm going to actually work a little bit in front. If you come over to the top here, a little bit in front, kind of the anterior edge of the upper trap again, and take that line down over the AC joint itself, and I might do a few, depending on what I feel, down and through over the AC joint into the delts. And sometimes the direction, like where you start to where you finish, it does make a difference, and that's where retesting after each technique helps. But quite often, I find that it doesn't really matter the direction you're taking it. And the way you know is once you've gone in one direction, if that made the symptoms actually worse, then you always want to try that same technique not always, but usually you'll try the same technique back in the other direction. And sometimes that'll kind of reverse that negative effect. And you know then, okay, in that case, the actual direction that I was taking that technique does make a difference, and you just kind of note that for the next time you see that patient. So here, yeah, I'm feeling some of the, he's shaking his head. some of the tissues that were affected in the actual fall. What a lot of people don't recognize is that, you know, you fall and you like separate your AC joint. Well, it's hard to separate an AC joint without affecting a lot of the tissues, you know, in the general area, sometimes kind of far away. Like I'm taking this all the way down to the elbow. And that's again why sometimes, especially in clinics where the practitioners are unfortunately really rushed and they have like 5 minutes just to focus on that one little area, you know, often things are missed. And so I think it's important to really understand that maybe the ground zero might be right where the actual injury and pain is, but there's a lot going on probably outside of ground zero that you need to address in order to get 100% you know, resolution of the problem. Okay, so now go ahead and stand up. First, let's try overhead again, see how that's feeling. Any pinch at all left?
Not a lot.
Just a tiny bit at the very end?
Can't even really tell. Maybe.
Maybe. Okay. So that's doing pretty good. And then across the front, what do we got there? Any change from last time we checked?
Actually, the second I went there, I got a little pop, and it feels great over here.
Okay. Good, good. Come on in again. So even though it feels great, I know for sure that there's stuff going on along the clavicle, along the collarbone that I want to address, or I'll have to come back tomorrow to this crazy gym and do this all over again. So, no, and on that note, what I will say also is that even though when I leave here, he's going to be basically pain-free in just a few minutes of treatment, it doesn't mean it's going to stay 100% pain-free. In my experience with these kind of injuries, usually I've got to repeat this 3 or 4 times total before it really like stays gone. And if he's already super fit, I mean, he does this for a living, so he's already done a lot of strength training, rehab type exercises. Most people that come in, they've had this kind of injury, they're, you know, there's a number of things that need to do on a muscular strength level to really make sure that the pain goes away and stays away, and that, you know, the entirety of the problem and injury is resolved. So, you know, he already knows what he needs to be doing. A lot of times with AC joint injuries, people get super weak, just almost all the muscles in the shoulder just because it hurts so much. And that's the beauty of the manual therapy side of things. It's not just that you can take the pain away, but you can open the door for people to be able to do the rehabilitative exercises that they need to do. Feel this actually goes all the way into his SC joint here where it connects to the sternum. And there's some stuff that we want to work down there, which I'm sure doesn't feel great, but it will after I'm done. And right through here, I'm kind of holding down. There's some ligaments underneath that are part of what gets sprained or stretched or even torn with an AC joint. So I'm kind of holding the tissue right above those, and then coming over the top of the clavicle on the skin. And I'm not getting underneath into here where there's a lot of nerves and blood vessels. I'm really staying right on the bone here. I'm coming across the top down to the SC joint. Yeah.
I can feel that in my sternum when you start here. Yeah. You get here and it already
you can feel.
It's crazy.
So a lot of times people will feel that fascial line of tension that occurred with the injury, and you know, they say, oh yeah, I'm feeling that down where eventually you end up going with your fingers. Okay, good. I'm also, like when I was just doing that, this kind of brief general stuff, I already know that there's some laxity in here, so I'm not getting after a lot of the tissues really deep where there's already some laxity, but just kind of working the superficial fascia, because a lot of times that stuff gets bunched up with these kind of injuries and can be part of the pain that's resolved or remaining. So let's test one more time and just make sure we got you pretty good for this first little session.
Yeah, there's no problems there. It doesn't feel like there's anything there now.
Cross.
Pretty good.
All right, so that's just a little bit of, and this is the kind of thing that we can do at Carter Physiotherapy for not just AC joint separations. Most shoulder issues can fall into this kind of category. If you've got a rotator cuff like full-on tear, it's gonna, you know, we're not gonna see that drastic of a change. But quite often, since we do hour-long sessions, what we did see in 5 minutes here, 10 minutes here, we do see in that 60-minute session. So if you got a shoulder or neck issue, look us up at carterpt.com. If you want to have a great gym to train at, check out Max Bookman at maxtraining.com or
maxtrainingatx.com.
maxtrainingatx.com. Thanks for tuning in.